Okay, so to thread the needle through, you need the right fashion needle. Okay, so originally, why is it called a fashion needle? Because originally, you do a fascia lata sling. You harvest fascia from the leg, and then yan ang gagamitin mo as a thread. But nowadays, because we have the silicone, we prefer using the silicone, and you don't have to have that extra procedure on the leg. Okay. Okay, so we thread it through this way, and then we bring it up to the eyebrow. And ganun more or less ang itsura. Pero sa akin, double yan. Hindi lang single. Sige, next. Okay, so let's try the video. So the incision, then we can go straight down already to the tarsus. See, you will be anchoring with the silicone tubes direction as a tarsus. Again, we anchor it direction as a tarsus and make sure that you don't pass the sutures through and through. So I use a nylon suture for this, para it does not absorb. Yeah. So it's already been anchored to the tarsus, and you can pull it up. So you just make sure to anchor it to the superior border of the tarsus, not so low. Otherwise, you will get parang notching. Yeah. Then we make the 3 stab incisions and pass the right fascia needle. So we pass it down. Parang sinusundo natin yung tube. So make it come up down there. Then we thread the tube through the eye of the needle, pull it up. So nandito na siya sa taas. Okay? So now, we anchor the lid crease, like what we did kanina. But of course, we don't really anchor it to the elevator. We anchor it, kasi the elevator hindi naman malakas. So we just anchor it to the pretarsal tissue or the remnant of the levator. Then we close the skin. And then we continue to pass the threads up to the apex. So you have to be careful with this fascia needle because it's also very sharp. So we thread it up. So now they're all up here. Okay. And then, yeah, there you can see already now when you lift this up, maganda na yung eyelid. And so these sutures, you have with these sutures here, when you suture them, you're actually adjusting 2 things. You're adjusting the contour, and then you're also adjusting the height. So first we adjust the contour because you have a left and a right. So you have to balance it, by pulling on both. When you have the right contour, then you can add some sutures there to adjust the height. Okay, and we want to get it up as high as we can. Okay, because in the long run that will eventually slow down. So here you can see the patient cannot close their eyes. So what we do is we put a frost suture, pull it up so that the eye will be closed temporarily. Because the eyelid is retracted, it's not gonna close. Okay, so that's it. The frost sutures I remove after mga 2 or 3 days, and then The rest of the sutures after 1 week. So this is a patient with blepharophimosis. Okay, and aside from doing the sling, we also did the epicanthal folds. No? So this is, I think, how many years later? 15 years, 10 or 15 years later. Okay, next slide. Okay, and here again, this is how we do the epicanthal folds. We do a Y to V. Yeah, Y to V. Okay, then, okay, so this is another patient. And then, okay, so this is the patient. Yeah, this is the patient that we did. This is the pre-op. This is the post-op. No? He really is medyo mapungay talaga. So hindi ko na rin tinaas masyado. No? When he lifts his eyebrows now, he can lift both eyes na. Okay, I mean, he can lift the left eye up. No? Before he couldn't lift it up. So maganda naman yung crease, medyo pantay naman. And he has now control over the eyelid when he lifts his eyebrow. See you next. And you know, it's not a perfect technique, so you have to advise your patients because thing is, when he's looking straight, it's fine. But when he looks up, the eyelid is still low compared to the other side because there's no muscle. Okay. And when he looks down, it's also retracted. No? So you have to tell the patients. That's one good advice. When he looks up, he has to lift the head up. When he looks down, he has to bring the head down. Then they understand that. Okay. Okay. So I think we're almost at the end. Okay. So Ptosis surgery is one of the most challenging and tedious operations in oculoplastic, and it tends to bring out the perfectionist nature of the oculoplastic surgeon. And it is truly where science and aesthetics meet, turning surgery into an art form.
Thanks, Frankie, for that very informative and beautiful lecture about Ptosis. No? Any questions from the audience?
Sir,
Oh,
question.
Sherman, Dr. Sherman.
Sir, di ba for the elevator, make the patient sit, and then, do you tend, do you initially overshoot to allow for later, magbababa siya ng konti? Or, immediate, goal is, kung
If-
saan yung initial placement?
If the function is very good, I just place it where I want it. I just make it pantay na lang. Because many times we're operating on both eyes, so you'll have some anesthesia already here. Diba? And so dapat pantay din yung injection mo ng anesthesia so that you know you can it will be even. Now, if the levator function is, let's say, a little bit weaker, like mga 7, 8, 9, ganun, it's a little bit weaker than the other side, then I sometimes compensate a little bit and put it a little higher than the other side because we'll expect it to go down a little bit.
What's the time frame for that? Do you have, usually tell them after a few years, how many years bababa siya ng konti?
No, usually within 2 to 3 months, it will already come down.
And that's the final.
The final is really 6 months, but 3 months more or less, yun na rin yun.
Any more questions?
Just to follow up from the slippage, does the suture material matter?
Yeah,
I
for
noticed
me.
you said that you use it, I mean, what you wrote down was Vicryl, but you use nylon in one of your videos at that.
Yeah, actually, nylon ito eh.
Yeah.
For the levator, I use nylon
But for
because I don't want it to slip. I used to use Vicryl, And sometimes the vehicle will slip not from the levator but from the tarsus.
Yeah.
This is slip siya from the tarsus.
May slow
Yeah,
disintegration. kasi-
actually, yeah, I'd like to share with our experiences before in PGH. So we used to put the bike there, no? Yeah, you know.
Yeah, because
it
the
absorbs
need-
and it does come in erosion. Right now we do, we use non-absorbable structures. I myself, I use silk. Silk,
Silk. Not
yeah,
nylon.
not nylon, yeah.
Silk 6-0,
Six out would be fine, okay? And it gets, it doesn't erode actually. Nylon, well, I don't have any thing about nylon, but you know, it's less rich, but the silk, when it's not exposed, it's not going to cause any reaction. So I find I myself, I like some to anchor that aponeurosis to the tarsus. Yeah,
Even the
Yeah.
handling of silk might be a little more easier than having
exactly, yes. Even closer of the skin. I find I'm a silk guy. Especially when ano,
plastic.
alam na niya na
So the vicryl is very nice to use because the needle is spatulated.
Yes.
Diba? So it's so easy to pass through the tarsus and it doesn't
Yeah.
go underneath, diba?
Yeah.
But then, you know, we sometimes get these patients where bumabagsak na naman. So
I'd like to share also the involvement of our sling. Before we used to you get the fascia lata. Actually, both of us have slippers. No? Before, ang ganda. Actually, you can do actually adjustable type of sling with a fascia lata. But again,
I experience your case though.
yeah, problem is that you have another incisions and legs, and the patient would complain more of their thighs rather than the lid surgery. But it involved. Actually, we can do this sling operation using silicone. Even in some surgeons, they use Gore-Tex. Which is more. I think Christine, you do, no?
I used to do Gore-Tex.
Ah,
And then
that's
I
fun.
just,
Diba?
and then I just
Order ka ba?
used the
Mas
same,
mura.
Yeah.
reaction.
actually, I remember this sling operation when I was a resident with your dad.
Oh.
Because your father, he liked he would harvest the fascia and everything and would use it. And then he has another technique where he brings it all the way up
to the
here,
forehead,
hanggang dito
yeah.
sa forehead. So pwede mo i-adjust
It's
dito.
a U-shape, actually.
So parang it's adjustable here because you can
Adjustable,
you can pull it here and then the incision's hidden here. Yeah. So but then we had to make it extra long kasi pamaabuti mo pa dito.
Actually, it's more aesthetic kasi dito you don't have the incision to the That's true.
We invited before president of the AP Sobers who did the single long fascia latas, di ba? And I remember he gave a talk on Ptosis. Question, sir, have you experienced using the back fascia lata? It's quite expensive. They say the reaction is very minimal, but true to class. I've used it. I had a reaction.
I haven't used it.
Yeah,
I haven't used it.
yeah, we used it.
Remember before they offered an Indian-based company surveyed peacekeepers asking if we would be willing to use, and we looked at each other. Baka when we visit India, they would all have the scar. So we didn't say anything. Yes, but they offered us po. Sa peacekeepers po.
Yeah,
Yes. Diba? Shocking, di ba? Parang would you be interested in buying from us?
Baka nag-react yung kasi ibang genetic makeup.
So, ano pala yung ginagamit ko?
Any questions from the residents? From the residents, from the first year, second year, third year, Doro, Steven? Questions? Actually, Ptosis is really an art.
Yes.
Perfect na rin. Ganda naman, ganda eh. It needs a lot of practice, yes. A lot of patience. A lot of patience. Ang mahihirap dito yung talagang zero, no function, especially in kids, no? And so challenging, especially unilateral pa, you know? So those are the challenges in those surgery. Okay?
Sir, last question, ano? Kasi ako, I assisted Rich,
Mm.
and he did it like a senior.
Yeah.
Yeah, mas, sa sobrang bilis niya, ako talaga, I was afraid because I assisted some consultants. Now, we ended up doing the frontalis instead of the levator section. Kasi hindi niya na-identify kagad yung vertical orientation of the levator muscle. But he was doing the dissection so fast. Nasa na yung when he was attacking the fat. But he did it still very well. No. So my question is with regards to training. Kasi there are specialties that have identified a certain number of surgeries that you have to do for you to be considered proficient. It's like yung cataracts natin.
Mm.
Like thyroidectomy, they have identified after you have done this, you would be good to go. Now, in your experience, or has there been a paper done by PG wherein you have identified, hey, if you did this number of levator ascensions, then you're ready to do your private case and not be afraid or be more confident about it. Meron na ba? Or in your personal assessment, you've trained a lot of fellows, what would be the magic number?
Good question.
I don't know, hard to say.
Maybe
I should-
We need to answer that from the
Maybe-
PPO standpoint.
From the PPO
It's
side.
not a required
Yes.
surgery. Because yun nga, you've seen the complexity. It really is reserved as fellow level. So ang requirement ng PPO is to assist more for identification of structures, etc. So they have so special knowledge ginagawa. So, but yeah, from the PPO standpoint, it's a must.
Maybe-
Not a must.
Maybe,
I think it's
maybe we should interview our fellows and see how many needs to be done.
Actually, I'll share also that I think the measuring point there is that when that person, that fellow is comfortable enough, hindi na siya mag-aalala. Like in paper, when you're already, used to it na, then you can go.
But
It
it
doesn't matter.
resolvers will be required to come up with a number.
Yeah.
For your,
Yep,
Kasi like you recognize required to come up with a number of vitrectomies.
Yeah.
Yan yun eh.
So resolvers will for your value.
Anyway, any more questions?
Nice, thank you. Thank you.
Okay, would like to thank again my good friend, Dr. Kleiner. Accepting our invitation sa mga ulitan, ha?
Sure, why not?
And don't forget, kailan ba yung balik ng daughter mo? Mga balik?
Well, yeah, well, she just had, yeah,
You
so,
know, Fran is blessed with a daughter who's a ballerina.
Oh.
Okay, and she would like to share.
yeah, so, well, my daughter kasi dances with Bali Philippines.
Mm.
And, well, come to think of it, they will have a performance tomorrow because there's this international dance festival. So, yeah, it's a circuit. So, she'll be dancing tomorrow night, one of the numbers, together with the Bali Philippines group. But by next year, then she will have more performances. At the moment, we don't know exactly when. I-Google mo na lang siguro. Bali Philippines.
Okay, thank you very much again.
Okay.
Any announcement from our chair?
No.
Okay, thank you very much.
Thank you.
Have a nice